machine learning in healthcare. She has 20 plus years of expertise and leadership at Dias-Data. She inspires audiences with practical insights on health equity and data-driven solutions. As a data educator, Dr. Deas empowers diverse professionals through engaging talks and actionable strategies. Dr. Deas, we're so excited to have you.
Thank you. I'm very happy to be here. I'll be seated, well, I don't know if unfortunately, whatever, I'm here. And I'll be seated because the table is seated, might be a little awkward to bend over, so just give me a second here to get everything going. Let me just go back to the presentation. So again, I try to inspire my students to, be more interactive in class and all that, and so I have some things going on in the background that I want to share with you all, which will both teach, educate, and entertain on a small level. But unfortunately, like I said, the Wi-Fi is the issue here. So we will get going with the presentation. 1 second here. All right. Let's start. Okay, we are live. All right, so again, I'm Dr. Kimberly Deas, and I'm actually currently working in medtech as a senior clinical data scientist. I previously spent the past 5 or so years working as a chemical informaticist, and before that worked as a senior data analyst in public health and for an organization which has the largest public health hospital in the United States, Pyton Hospital. So there was this dichotomy in my background between my work in chemistry, which I did from 9 to 5, and then the work I did working on my PhD in healthcare informatics, which was mostly in a healthcare informatics space. Public health, healthcare informatics has always been the heart of what I do for a living. My mother was an epidemiologist back in the day, and so that's what my inspiration for infectious diseases, health informatics actually originally came from. So today I'm going to be talking about data viz and Python, the tool to study health disparities. So what I've created here, had to kick off with the data visualization because that's what this is all about today. So what I initially show is a word cloud. So the keywords that I took some words from my dissertation or from my abstract. I did some Python coding and said, come up with a word cloud, and this is what came up when we were talking about HIV health disparities. So you can see, employment, poverty, education, support, those are all real key things that are important for people who are living with health disparities, especially HIV health disparities. And then the second one basically is a highlight, donut chart, I think is what this is called. So that one is just basically showing HIV health disparities, the most important factors in that. So that you see living below the poverty line, unemployment, and having less than a high school education. So again, these are 2 examples of a visualization that can create in Python. And the goal, of course, is to express to people, stakeholders especially, how important addressing HIV health disparities are. And so I could put these things on a list or a table, and that has some impact. But when you do something like a visualization, I think it has more impact, and it actually is able to influence more audiences, because here with the visualization, people are more inclined to be into what they're seeing versus reading a table or a chart or even just something that's written down. All right, so let's get started. So my agenda today, I'm going to talk about some of the objectives, why I'm here. I'm going to do a pre-Kahoot quiz, and this is again is where I might have went a little bit overboard with technology and trying to make this lecture fun, but hey, I think it works. I hope you enjoy it. We'll see when we get to that part. Then I'm going to go into an introduction to health disparities, followed by a discussion of important Python libraries for visualization. I'll talk about some key visualizations which are really important for communicating health information in public health settings, because I do think there's a difference in how I communicate to a board of directors versus stakeholders in public health versus clinicians, right? So you have to be able to tailor your message to your audience. I'll talk a little bit about how to do that. Next, I'm going to talk about applying data viz to HIV health disparities. So I'm actually going to pull some visualizations from my dissertation, which has not been published yet. Do not steal my stuff until I publish, please. Just to show you a little bit about how it works in real time. And then lastly, and probably most importantly, ethics and effectiveness around visualizations is super important. So I'm going to show you some examples of what to do and what not to do when it comes to visualizations. And then finally, I'm going to have a post-Kahoot quiz. Now, the pre-Kahoot quiz and the post-Kahoot quiz, you'll be playing for the dynamic prize of a $25 gift card to Panera Bread. So hopefully you like Panera Bread. Now, I understand with $25, you could probably only buy 2 bagels. But, it's something, right, to get everybody interested. Okay. so again, talk objectives, how data visualization serves as a powerful tool to uncover, analyze, and address health disparities. And then more importantly, we're going to talk about how we use Python versatility to create impactful visualizations. So now I need everybody to go to kahootit.com, well, to Kahoot it, right? When you get there, you're going to enter a game pin. Now this is just, we're gonna do a warm up before we get into our active competition, okay? The game pin is 158179. So you go to Kahoot it, you enter in the pin 158179, and Michelle, thank you, Jimmy, Joy.
Can you repeat the number again?
Sure, the number is 158179. All right, so we're gonna do a warm up first before we get into the competition. The questions are gonna be around health disparities and around visualization in Python. So just as a reminder, this course is a little bit more advanced and for beginners, so we're gonna really get into details about how to do visualizations, and I thought it would be fun to start off with a quiz. So we're gonna get a practice in, this is our practice. Let's see. Wow, we got a lot of folks joining in. Thank you so much for participating. Okay, is everybody signed in who wants to participate for this grand prize of a $25 gift card to Panera Bread? And just a FYI, if you win the first one, you may not compete for the second one. We want to share. Okay, so whoever wins, just know that you cannot get 2 cards in one day. All right, is everybody ready to go? All right, let's get started. Okay, so does now everyone see practice Kahoot game on your screen?
Still loading.
Is it still loading?
Get
Okay,
ready,
we'll give it a
loading.
few seconds.
It's coming up.
Everybody got it?
Yep.
One.
Who is the best living rapper? We got Kendrick Lamar. Do you guys see the questions there?
No.
It has like symbols, like
Okay,
shapes.
all right, so the red symbol is Kendrick Lamar. The blue symbol is Drake. Oh, that's a hate. Okay, the gold symbol is Jay-Z and the green symbol is Megan Thee Stallion. I'll repeat that.
It like automatically.
Oh gosh. Okay, sorry about that, guys. Looks like it just really went. Okay, so I'm
It's
just.
intended for us to be able to, for you to be
I
projecting.
know, but I can't. Yeah, we had some technical thing here, so unfortunately, it's not going to work that way. You guys don't see the questions. All you see is just the.
All we see is the
shapes?
symbols.
Okay, this is going a little too fast. All right, we'll try to make it as fun. Unfortunately, only 3 people got it in. The answer was Kendrick Lamar. Sorry, y'all. It's going a little bit fast. But let's see. All right, it's just fun. All right, so this is a practice though. So you'll have a little bit more time with the other questions. So here's the next practice question. So scoreboard. AH is winning. Who's AH? What? Okay, Andrea. No, Andrea. Andrea and I work together. Michelle, Isabella, Ketchen, and Jimmy. Okay, y'all gotta be quick, okay? Gotta be quick. I guess she heard Kendrick Lamar and just immediately went.
But that's what I did, and I didn't get as much help.
That's what I
All right, next question. I guess I should have adjusted the timing, but okay. Again, these are practice questions. What is popped in the air while doing the boots on the ground dance? A boot is the red bar, blue is a fan, gold are fingers, and green is how the hell do I know? What is popped in the air while doing the boots on the ground dance? Red boot, blue fan, gold fingers, green how the hell do I know? Looks like I gave you guys more time on this one. Okay, so answer is a fan. Isabella is now in the lead. Where's Isabella? Okay, go ahead, Isabella. Okay, girl. All right, we got Roland in second place, Secret Squirrel. Okay, I know that is not on your birth certificate, but okay. Zach G and AH is in third place. All right, so next question. Again, these are just practices just to get you guys used to how it works. Who is the best living entertainer? The red is Taylor Swift, blue Beyonce, green Justin Bieber, and green is any entertainer born before 1980. Shade intended, sorry. Okay, best living entertainer, Taylor Swift red, Beyonce blue, Justin Bieber, any entertainer born before 1980. Looks like a lot of y'all went with Beyonce. The answer is any entertainer. I did these questions, it's mine. Okay. Roland is in third place, Isabella is in second place, and in first place is, and I'll show everybody so you know I'm not cheating. Zach G. Woo! Zach G is the winner. Alrighty, so Zach G had 15-13. Isabella, actually it was a tie. It was a tie for first. And sorry guys, I only bought 3 cards, so or 2 cards. And then Roland was in 3rd place. Okay, Zach, so come and get your come and get your Panera Bread card. Where's my purse? Where's my purse? Did you grab my purse? Yeah. All right, so get that card over to Zach. All right, so now, I'm sorry, that was a practice game, sorry. That was just practice, but I do still need the card because now we're gonna start the game. All right. Everybody still with me?
Yes.
Okay. All right, so hopefully you'll have a lot more time. So yeah, this, I'm not sure what happened with the design, but I'll have to get that straight before I teach my class next month. All right, so now we're gonna go into the questions for about data viz and about health disparities, again, with the Kahoot, and this will be a whole new number. So everybody prepare for the number. Okay, so the number is 895025. 895025. Now this is for the Panera Bread card. The other one's a warm up. Everybody signed up? Anybody not signed up? Everybody good? Mm-hmm. Okay, you will have more time to do the questions on this one. All right. Okay, there are 10 questions. What does HIV stand for? Red, human immunodeficiency virus. Blue, health infection virus. Gold, high immune value. Green, hemoglobin-induced virus. Red, human immunodeficiency virus. Blue, health infection virus. Gold, high immune value. Green, hemoglobin-induced virus. Okay, the answer is human immunodeficiency virus, and in first place is Keithian. Am I pronouncing your name correctly? All right. Second place, Arjun. Third place, AZ. Let's go to our next question. A lot of people got that right. 2 people did not. So it's human immunodeficiency virus. Which age group has the highest HIV prevalence rate? Red, 0 to 15. Blue, 16 to 24. Gold, 25 to 34. Green, 35 plus. Highest prevalence group, prevalence rate of HIV. And I gotta get some more time for these questions. All right, so the answer is, should be, oh gosh, where's the question? Sorry about that, guys. Should be the second one, the second age group. So AZ, you're in first place. Keithian's in second place. Third question. Which type of data visualization is best for showing trends over time? Red, scatter plot. Green, blue, line plot. Gold, histogram. Green, pie chart. Best visualization over time. Scatter plot, red. Line graph, blue. Histogram, gold. Pie chart, green. And the answer is a line graph. Okay, let's see who's from first place now. AZ is still killing it. Where's AZ again? Who's AZ? All right, AZ. AH is in second and Joy is in third. This is the fourth question. What does a box plot visualize? A, a summary of distribution including median and outliers. Blue, changes over time. Green, heat map. Gold, relationships between 2 variables. What does a box plot visualize? Red, distribution over time. Distribution and outliers. Changes over time for blue, relationships, gold, and heat map. So the answer is, everybody got that one, fantastic. It is red. A distribution of, summary of distribution including median outliers, red. Congratulations, everybody. Let's see who's in first place now. AZ still killing at the top. AH is right at his heels. $32.99 for you, AZ, and $31.75 for AH. Okay, question number 5. Which region in the U.S. has the highest HIV rates? Red, Northeast. Blue, Midwest. Gold, South. Green, West. Red, Northeast. Blue, Midwest. Gold, South. West. And the answer is, of course, the South, where they did not adopt ACA. I'm just saying it is playing a role. We'll talk a little bit about that during my talk. So the answer is the South. Okay, scoreboard now. AH is in first. Joy. Where's Joy? All right, Joy then snuck up on everybody. Number 2. Okay, question number 6. Why is it important to disaggregate health by race, age, and gender in visualizations? Why is it important? Red, to make charts look more colorful. Blue, to reduce the need for analysis. Gold, to identify and address inequities. And green, to exaggerate differences. Why is it important to disaggregate health data by race, age, and gender visualizations? The answer is to identify and address inequities. That's gold. All right, let's see who's got the lead now. AH still in the lead, 4934, Joy at 4905. So right there. Sal is in third. Next question, 7 out of 10. Which Python library is commonly used for creating static plots? Matplotlib red, scikit-learn blue, TensorFlow gold, PyTorch green. Creating plots in Python, Matplotlib red, and it is Matplotlib. And for those that didn't know, that's why you're here, so we're gonna cover that. AH still in first place, Joy in second. And I mean, it's like a 7-point difference there. Y'all are really fighting it out. Okay, 8 out of 10. Which group has the highest risk of becoming infected with HIV in the US? Red, heterosexual women. Blue, men who have sex with men. Gold, transgender men. Or adults over 65. Green, red, heterosexual women. Blue, men who have sex with men. Transgender men, gold. Adults over 65, green. Highest risk of becoming infected with HIV, men who sleep with men in the United States. All right, let's see what our scoreboard looks like now. Sal is in first place, followed by AZ. All right, 2 questions left. A dashboard showing asthma rates in low-income neighborhoods is an example of what? Red, predictive modeling. Blue, inferential statistics. Gold, experimental design. Green, descriptive visualization. Low-income neighborhoods in a dashboard. Predictive modeling, red. Inferential statistics, blue. Experimental design, gold. And descriptive visualization. The answer is descriptive visualization. All right, let's see what that scoreboard's looking at now. Sal is still in first place, followed by Keithian. We got 1 more question, and I'm not even sure you're going to be able to answer this one because of how I think it's a Python problem. It's double points. Okay, see if you guys can follow this. What is the output of this Python code snippet that you can't see? It's EX is equal to, I have curly bracket, an A in quotes, I have a semicolon and a 1, comma. I don't know why I'm going through this. B in quotes, semicolon 2, curly bracket, closing it, EX dot update, parentheses, why am I talking about this?
Write it somewhere so we can see it.
No, I'm actually following, I just don't have time. I just don't have time.
Oh, but we're not gonna have time.
Okay, I'm gonna finish it anyway, because I got time, a little bit. So EX dot update, and then parentheses, curly braces, B in quotes, colon 3, C in quotes, colon 4, close your bracket, close your parentheses, comma, print EX.
Got it.
What are the options?
Yeah, now we need the options.
Oh, syntax error. I'm sorry, I messed that one all up. All right, anyone who guessed syntax error?
Me.
Before I even said it. Sorry about that,
I
guys.
felt it. It was a. I got
That was a
it.
good guess, right? After all of what I said, it's got to be a syntax error, right?
Obviously.
Okay, so let's see who the winner is. Sorry about that last question. I will definitely get this worked out before I teach my class. 3. Okay, number 3 is Sal. Number 2 is Zach G. And our winner is Keithian. Congratulations, Keithian. You are a winner of the $25 Panera Bread card. And I will need my purse still to get you that. Hold me to that. We'll get to that later. Thank you, everybody, for participating. And now I know what I need to clean up before I teach this class next month. I appreciate y'all's help. There's your card, Keithian. Congratulations. All right, let's move on. Okay, so first we're going to define what are health disparities. Now, okay. Now, I said I wasn't going to get political. But as a person that works in public health, it is almost impossible not to get a smidge political because These people that worked at the CDC, that worked at NIH, are not there anymore to help with this work that needs to be done. All right, I'm gonna do my best with that one. Okay, so health disparities are a couple of different government organizations that have definitions. A population is defined as being disparate when it comes to outcomes, morbidity, mortality, and prevalence survival rates, when you can make those distinctions by race. That's the Minority Health and Health Disparities Research Education Act. The Centers for Disease Control in 2016, differences in the health outcomes or health determinants observed between populations. And then lastly, a health disparity is a type of health difference that is closely linked with socioeconomic and environmental disadvantage. Really profoundly important to mention that, right? Where you live, how much money you make, your education level, the environment you live in play a role in whether or not you will have a similar outcome to someone who lives on the opposite spectrum. Okay, so that's from the Office of Disease Prevention and Health Promotion. Natasha, could you get me some water real quick? Thank you. All right, oops. All right, so why do health disparities exist? Well, I just described to you some things which fall under what I'm going to later define as the social determinants of health. There's education, income, food access. But systemic racism, so anyone that's worked in the public health field, my mother worked for, 40 years, initially as a public health nurse, then as an epidemiologist, and eventually with the feds. We've always known, I grew up in a household where we just knew that systemic racism and discrimination leads to different health outcomes. But for whatever reason, it wasn't talked much about. And I think maybe in the last 15 years that it's been talked about, when actually has existed since Africans came to America in 1619, right, if I'm really being technical. So systemic racism and discrimination are words that have just been taboo and are even more taboo now with the change in administration last year. But it doesn't erase the problem. And as a matter of fact, I think with a lot of the cuts, the problem is going to be more exacerbated. Anybody that works in this space kind of knows that. All right, moving on. So what are some examples of health disparities? Well, I talked about HIV. In this case, Black women have the highest prevalence of any other race. Increased diabetes prevalence among Native American communities, and then lower life expectancy in low-income neighborhoods. Those are all examples of health disparities. Okay, so healthypeople.gov defines social determinants of health, SDOH, as conditions in the environments in which people live, learn, work, play, and worship. And their age can affect a wide range of health, functioning, and quality of life outcome risks. Thank you. Okay. All right, moving on. Now, let me just stop right here for a second. So I define social determinants of health as the way that it's defined, right, for my dissertation. But I also introduced a term called social influences of health. And the reason is because determinants is definitive. It's a definitive word. So it's like you grew up in poverty, you're doomed to never be educated and to have a higher risk of HIV and all these other things. That's not true, right? Yes, you probably have a greater risk of those things, but I don't care for the word determinant because it's so defining. So I turn it to influences because these things influence, right? Your environment influences, the school you attended influence, your parents' education level influence your opportunities in life as opposed to determinants. So, and then one of my committee members said, well, you haven't really established yourself in the field enough to be changing around the vernacular. I'm like, okay, but I'm using it anyway, right? So again, for this presentation, this is what the word is, but for my dissertation and for the work that I'm going to publish in the future, it's going to be social influences on health for the reasons that I just described. Okay, moving on. So social determinants of health are defined by 6 categories: community and social context, economic stability, income, education, food, healthcare systems, neighborhood, and physical environment. Now, I did some proxies when it came to my dissertation. So for example, neighborhood and physical environment, I've defined crime as that, physical and community violence under neighborhood and physical environment. Social and community context, I put stigma under that. Food insecurity, I put under food, and healthcare access, I put under healthcare system. Okay, it's legible. All right, so the Kaiser Foundation does some phenomenal work in this field, thank God, because I'm going to be leaning on them for information with the idea that they're going to keep their websites up. Anyway, social determinants of health, I just defined as 6 subjects, but I also want to mention the fact that these days people are talking about racism being listed as social determinants of health. I think that's probably appropriate, okay? It's not official yet, but there are a number of groups that say that racism should be added to this list. So economic stability, employment, income, expenses, neighborhood, physical environment, ascribed, violence or crime in the neighborhood, education, literacy, language, food, hunger, access to healthy options, community and social contexts, social integration, support systems, etc., and then of course healthcare systems. Now all those things contribute to one's health outcomes. So that could be mortality, morbidity, survivability, life expectancy, health status, and also functional limitations. Alright, let's get a sip here. Alright, let's move on to the next slide. Okay, so what is the relationship between the social determinants of health and health disparities? I was pretty shocked. I started this work back in 2016, and I was profoundly shocked to learn that the factors which contribute to a person's life expectancy, premature death, are things that they have no control over. Like, I can't control the genes that I inherited that might make my propensity for developing breast cancer stronger than someone else's. I can't control the education levels that my parents had, the neighborhoods that they were able to afford to live in based on their education level. Social and environmental factors, no control over that. So about 60% of a person's risk for premature death has nothing to do with their behavior. So what I see a lot in public health are stigmatizing attitudes, even among people that work in public health, about people's propensity to commit crime or be promiscuous and end up with HIV, all these other stereotypes that just aren't founded in facts. These are the facts. Your genetics, your healthcare, social environmental factors, the things that you don't have control over. Your behavior is only 40% of your risk of premature death. So this was a wake-up call to me, even as a researcher, because even I can concede that I started to buy some of the stereotype about people that live in lower income, communities. I grew up, both my parents were educated and, we very differently than say someone whose parents were not. So I had to check myself in a lot of ways about how I thought about the communities that I'm ultimately trying to help. So I had to address my own bias, right? So everybody has it, no matter what your background is. We all have bias, and some people's bias are more impactful or more profound than others. But this was a real wake-up call to me about how I think about the communities that I hope that the work that I do will impact, that most of what they deal with has nothing to do with their behavior. Okay, so moving on. Now, as a scientist who once worked at the bench, I would be remiss not to talk about HIV. Any scientists in the house? Any bench scientists? Yay. Just a few of us in here? Okay, that's all right. Okay, so again, I have to talk about HIV. A class of viruses called retroviruses. It weakens immune systems by attacking CD4 cells. And as a result, untreated HIV can lead to opportunistic infections like pneumonia and cancer like Kaposi sarcoma. So here I just describe how HIV works to infect T cells. Again, this is for all the scientists in the house, and those of y'all want to look, y'all can too. So HIV binds to specific receptors on the host cell, T cell. It inserts its proteins and its genetic information. That genetic information is converted from RNA to DNA via reverse transcriptase, which it also injects into the cells. It basically integrates into the host cell DNA. Now it's making HIV DNA, and then ultimately that's going to result in the release of new HIV particles. So you can read that a little bit more on my scientists in the room if you're interested. Okay, so this study started in 2016. So you're like, why are you talking about data in 2016 from 2018? Well, that's just kind of how it worked out. There was a pandemic. I moved, I changed jobs a couple times, and I got this thing done. I literally just finished in January. So this was kind of an 8-year haul, which I did the best I could, got it done, and that's all that matters. No one's ever asked me how long it took to graduate, so there's that. Okay, so I started in 2016, so this was obviously more relevant in 2018. What I'm working on right now and to publish in the future is I'm going to compare post-COVID HIV among Black women in Texas versus what I got in 2018. Now, I expect an exacerbation, and especially now with the new administration, I won't be considering data past 2020. So to be a comparison of what I saw in 2018 compared to what happened post-COVID, in case anybody's wondering why I'm still talking about this old data. All right, so getting back to the presentation. In 2018, there were about 1 million individuals in the United States living with HIV. But due to the creation of treatments for HIV, life expectancy is not the death sentence it was in the 80s when I originally started working in infectious diseases. And so that's a wonderful thing. In fact, if you can keep your viral load suppressed, you can live almost as long as someone who is not HIV infected. So that's a tremendous, if you think about what we were able to do in a lifetime, that's pretty incredible. People who supported HIV, that community did some amazing things. Because to me, to think about in my lifetime that a disease like this was able to be not cured, but treated in such a way that a person could live a normal lifetime is incredible. And I remember the hordes of people that I knew that were dying of HIV back in the day. Like I said, it was a death sentence back in the day. Okay, so, and as a result of these efficacious medications, the largest group living with HIV is actually over 50. Now, the challenge with being over 50 is, besides your knees and your elbows and everything else starts hurting, I'm representing here, is that other comorbidities like heart disease and diabetes can kind of come into play. And so there's a whole other new set of things that we have to look at now when we're looking at this population. Now, perinatal treatment of HIV has very likely contributed to why children under the age of 13 represent the lowest percentage of people living with HIV at 0.19%. So what that basically means is that if a mother tests positive for HIV, the baby can be treated prenatally, and that will prevent the HIV from passing from mother to child. And again, that's a great discovery. So what I have here is just a table with information about HIV in the United States. And as you can see, there's really no pizzazz to a table. I mean, you could create this in Excel. And again, it doesn't really move people the way visualizations do. And so I can't wait to show you some of those moving visualizations a little bit later. All right. Now, HIV in Texas. Even though I'm not from Texas, I relocated there initially to study informatics and ended up transferring to Rutgers University, go Scarlet Knights. Wonderful thing. But I chose Texas because to this day, I have never in my life seen a state with so many resources, right, via oil and gas and whatever else they do down there. But the poverty that I saw, the homelessness that I saw, the HIV, I mean, it's hard to reconcile, right? Again, Texas didn't adopt ACA, and so it wasn't a surprise that they didn't see the decreases in this population the way some other states did that did adopt ACA. That was a pretty profound. Their decision not to expand Medicaid impacted disadvantaged communities. All right, so I chose Texas because I felt like a spotlight needed to be put there, and I think it overall could be helpful for the movement of helping people who live disadvantaged lives living with HIV live better lives. Okay, so in 2018, African Americans represent the largest percentage of Texans living with HIV at 37%. It's like a little typo there. This was followed very closely by the Hispanic population, which you probably guess with the proximity to Mexico that there are a lot of Hispanics living in Texas. Along racial lines, Hispanic men had the highest percentage of men living with HIV in Texas at 36%, and Black women were the largest group at approximately 56%. So this actually mimics what we see on the national level in terms of demographics. Again, like other places in America, MSMs represent the highest percentage of people living with HIV at 61%. So what I have here, again, is just a basic table of how this breaks down based on race and ethnicity in Texas of people living with HIV in 2018. So again, tables are just boring. This is what it is. So I just want to show you a boring table here. All right, let's go into something a little more interesting. Okay, so this is a bar chart. Basically, bar charts look at a category on your x-axis, and you look at a count of that category on the y. So here what I'm representing are the top 5 counties in Texas of Black women living with HIV. I use the phrase Black women living with HIV as opposed to what we used to say, people infected, because one is a very stigmatizing phrase, the other is not. So hence we go with Black women living with HIV. Okay, so Harris County, which is home to Houston, Texas, has the highest prevalence. Probably makes sense from a demographic perspective. And then the lowest is San Antonio at 271. This also follows census data. If you look at the census populations for these counties, it follows that same line. Oops. All right, so with that, I want to ask, are there any questions about health disparities, questions, comments, suggestions, etc.? Anyone? Yes.
On your bar chart for Texas,
Yes.
the 37%, not the bar chart, I'm sorry, the table. The 37% says that the Black population in Texas is 37%. Is that what it says?
No. That's people living with HIV.
Oh, living with HIV. Okay, I got you. And the female and male is just, again, people, the black population living with HIV is that percent of the population?
That percent of the people living with HIV.
I got you. Okay, thank you.
Yeah. So it says percent of Texans living with HIV 2018. That's the bar like above that. Okay, any other questions? Are we ready to code? I'm ready to get to the good stuff. Okay, not yet. Just about. Alright, so there are a number of different Python libraries for visualization. Matplotlib is the one that pretty much everybody uses. I use it a lot. Seaborn, Plotly Dash are used for interactive visualizations, and I won't talk about that platform that begins with a T. That's really popular with dashboards. I'm just throwing this one out here as an option too. Okay. And of course, GeoPandas Folium for spatial analysis and mapping. Again, a lot of the visualizations that are used kind of in the public health space to point out disparities. Okay, so this is just some more detailed information. I'll make my slides available to the conference at a later date for people that want some more information. This is just a summary of what each of the different packages does. Matplotlib is, like I said, it's the core library for creating different visualizations, interactive plots. Seaborn builds on that. Bokeh is another one that people use for visualizations. I used to use Bokeh a lot, but now I'm kind of partial to Seaborn mostly. Again, Plotly and Dash talks about how that works, interactive charts, dashboards, and web apps in Python. And that's actually a cool feature that you can create something and send it to someone and they can actually look and be able to interact with it in real time. Is a nice little feature. And then of course GeoPandas and Folium. Actually, I've never used these two. Again, I use something else that begins with a T for those types of work, but this is about Python today. So GeoPandas enhances pandas with spatial capabilities. Folium is interactive maps and leaflets. And again, I've never used those two, so I can't tell you much about those. Alrighty. Alright, so key visualizations that I use in my healthcare work though. Bar charts, an example, looking at chronic disease by demographic. I give you an example where I looked at counts of Black women living with HIV versus county. Line charts look at trends over time, things like vaccination rates. Heat maps are probably my favorite because they're most visually appealing. I'm a visual person, so I tend to do pretty much anything I can do in a heat map I'm going to do. Here you can use it to show geographic disparities, and then violin plots. Now, this is debate, violin versus box plots. They're both pretty great. What I like about violin plots is that you're able to look at a distribution, right? So I don't just want to know the outlier is there. I want to see what the actual distribution looks like, because that tells me a little bit more about my population. That's just personal preference. Okay, so visualization examples. This is a line chart. So here what I've shown is the number of HIV cases per county, and you can see the lowest number looks like Travis County, and it goes up to the highest, Harris County again. Travis County is Austin, and Harris County is Houston. So this is just a basic line chart. Here I'm showing firearm fatalities by HIV case count. This is actually real data. And so you can see that as the firearm fatalities go up, it seems to parallel the HIV cases going up, with Houston having the most firearm fatalities and also the highest incidence of HIV. So I mentioned earlier that, maybe I hadn't mentioned it yet, but there is a correlation, and this is some of the early work I did on my dissertation, between violence prevalence and HIV prevalence. Wherever you see a lot of violence, you're going to see a lot of HIV, at least in Texas. And it probably mimics other places too. Okay, so this is a horizontal bar chart. So before I showed you a vertical one, this is a horizontal one. So on the y-axis I have my counties, and then I have my number of HIV cases. So I basically just kind of inverted the axes here, just to give another example of a type of bar chart you can do. Some people like these. One of the other things I did here is you see there's a gradient of color, and the gradient of color is mapped to the counts of people that are Black women living with HIV here. I'm sorry, total counts of HIV here. Okay, so I mentioned a violin plot. This one I'm showing the relationship between household income and viral suppression. So I mentioned about the social determinants of health. And that actually kind of came by accident. I initially started looking at crime and HIV prevalence, and then I thought, well, wait a minute. And this is before social determinants of health kind of became the keyword that it is today. And I thought, that's awfully coincidental. And then I looked at income, and then I looked at, availability of healthy food options, and I thought, this just has got to be something going on here, right? So that's where the systemic racism part kind of comes into play. All right, so now we're going to move on to the heat map that I mentioned, my favorite. Okay, so here what I'm showing is a correlation map between the number of Black women living with HIV and selected county health rankings and road map data. So for anyone in the room that's doing social determinants of health research, I would highly suggest these yearly reports that are produced out of the University of Wisconsin, I believe. It's called the County Health Rankings and Roadmap. So it basically breaks down social determinants of health of every county in America. It was profoundly helpful as I was coming to the end of wrapping up my dissertation. And it's just some great information. And I don't imagine it'll get shut down randomly, right? So it's not like hosted by CDC or anything like that. So if you go to University of Wisconsin, and look at CHR-R, you'll find this data. So here what I'm showing is the correlation between different social determinants of health factors and viral suppression. So what you see here is you have a positive correlation, so that means as one thing goes up, the other thing goes up. So as you have more people virally suppressed, you also have, household income at 0.91. So that means that there's a direct correlation. The higher your income is, the more likely you are to be virally suppressed. That is profoundly important information. On the flip side, you can see the homicide rate. If you live in an area where there are a lot of homicides, that is profoundly inversely correlated with viral suppression, which means that if you have an area with high homicide rates, you probably also have low viral suppression, which isn't good. We want people to be virally suppressed. So this is a great way to see how different things correlate, called a correlation matrix, and we're actually going to build one today. We're actually going to build this one today. All right, so now let's get ready to code. Everybody can go to Jupyter Notebook or whatever you code in Python, and that's what I use. And now we're going to do some coding. So I'll give everybody a few minutes to get that set up. Any quick questions here?
Why did you correlate to firearm death instead of like all murders when you?
I'm sorry?
You had one graph with firearm death, I think, yeah. And well, here it says homicide rate, but the other one was like a line chart, and there was like firearms, not like all murders. And I was wondering why only firearms.
Because some of this was information I kind of had just knowing about what happens in different communities. There's a lot of gun violence in low-income communities, and so I kind of, went in with an idea about what I needed to be looking for, and the data just bore out what my hypothesis was. Firearms are a leading cause of death in America, period. Now, whatever I'm a believer in, and exercise. Which one is it? Is it number 2? Okay, so I believe in number 2. I mean, I grew up in a military family. I live in a military neighborhood. There's number 2 everywhere, right? Okay, that doesn't sound good saying it that way. That really sounds really good.
Second Amendment.
Right? Second Amendment. That's what I should be saying, not number 2. Okay. So Second Amendment, strong believer in that. So knowing that America is about firearms, I knew to hone in on that. And it turns out that a lot of that homicide rate is related to firearms, right? What's also interesting is what's not necessarily shown here, where it's a homicide rate is 0.8, firearms is 0.48. So you're like, well, wow, how are these other ways that people are dying? Suicide, and then murder would obviously, by other means other than firearms, right? So that was just kind of my living in America. You're gonna look at fire. If you're looking at violence and you're looking at death, firearms is just what comes to mind. And then you can look at the news every day and get a reason as to why I focused there. So yeah, that was kind of my rhyme or reason for that, and suspecting that the data would bear that out, it did. Any other questions? Alrighty. Alright, so is everybody ready to code? Everybody got their Jupyter Notebook up? Okay, so now I might need some help from the AV folks. Are they still in here? Okay. Alright, so I'm gonna stop. Do I want to stop this here and then switch over to my notebook, or? Actually, you know what? Let me go to break first. The break slide should have come before this one. How about we take a 5-minute break, and then we'll come back and get ready to go. How about we do that? And then I'll get set up while you guys are on the break. Okay, sorry about that.
That's okay.
Everybody good to go? Okay, so the first thing you do when you go to a notebook is you're going to want to import all your libraries and packages, everything you're going to need. Here we're using NumPy. We're using pandas, so those allow us to manipulate our data. Matplotlib, I mentioned before that that's a very popular graphing package, and we're also going to use Seaborn. Okay. Well, hopefully it runs great now that I'm here. All right, so everybody got that. NumPy and pandas allow us to work with data. Matplotlib is our basic graphing tool, and then Seaborn is a more advanced version of that. Everybody get that going okay? All right, fantastic. So now we're ready to import our data, and this is where pandas comes in, right? So we have read CSV function here. The data is called Python data, CSV. Then we're going to do a head, which is going to give us, I'm saying head 10, although typically head only gives you 5. First 5 rows, we're going to do 10 here. and then that's ability to look at our data. Now, I mentioned before that the source of this data is secondary data I got from the state of Texas. Thank you, state of Texas. They were very generous. The Department of Epidemiology were very helpful in helping me get this data together for my presentation. And also the CHR data. So I mentioned the county health records, reports and roadmaps give you social determinants of health information. So all of the social determinants of health information you see here, they maintain it on a county level. I did a join in SQL. That's a whole other programming language and a whole other topic, right? To create the table that you see here today, I also added county level data that I got again from secondary data from the state of Texas. I joined them together in SQL, created a CSV, exported a CSV file, and now I have this table that you see here. Everybody got that going okay? All right, now we're gonna go to line graphs. So again, I mentioned basic line graphs, just trends over time, are typically what they're used for. Here, I'm not using time as my variable, but I'm looking at firearm fatalities in counties, right? So looking at counts of firearm fatalities as it relates to HIV. Okay, so here we are first going to just, okay, so one thing things I really love about coding is that there's multiple different ways to do it. Now, I am not a software engineer, okay? Not remotely so. I code in a way that makes sense to me, and what I realized when working with software engineers, they probably could do all of this in 2 lines of code. I think that's great. I'm just trying to get the end product, and this is how I did it. So if you guys have a quicker way of doing it, more power to you. I do it the way that gets it done. Try not to confuse and complicate myself and go on from there. I also tend to talk a lot, which you guys might have picked up on, but at any rate, what that translates into coding or comments. So I try to always comment everything. I suggest everybody do the same because someone coming up behind you won't know what you did.
Including
Right? Exactly. So everything I do, I pretty much have a comment. So first I'm going to sort my data, in order of largest cases. I'm then going to create my line graph, and I'm going to use PLT, which is from Matplotlib. I'm going to annotate each data point because I want to, be able to see on my graph where each data point lies, right? And then I'm going to add titles and axis, and then some tricky formatting, and then I'm going to use PLT to plot. So that's what I have here. So we'll run it here. Name. And of course, it didn't work. Let's see what happened here. Data is not defined. Oh, did I run?
You do not run
Did I forget to run my data? No, I ran data. I thought I did that. Data.
No, you
Okay.
Install the notebook.
All right. Once again. Okay, here we go. Okay, so again, what I have here is what I showed you in the presentation. HIV cases on my x-axis, firearm fatalities on my y, and then I labeled, I coded to label each plot and then make it look like a circle so you could easily find it on the graph. This is pretty telling to me when it comes to where resources should be concentrated in the era that we live in where there are few resources, right? Or the resources are shrinking, especially I think NIAID had the highest number of funding cuts, which is utterly ridiculous in a pandemic, but another conversation. The idea being here that we use this information as best we can with the limited resources that we have to impact as many communities as we can. So again, if you're Texas and you're like, we've only got a limited amount of money, where should we focus? I could see issues being with Harris County being selected, but when I look at HIV data, I'm thinking if you have a choice, you want to go to where the disease burden lies, and that's unfortunately Harris County, Texas. Okay, now we're going to go on to bar charts. So again, what I decided to do for this presentation was to include visualizations that are simple, that are easy, that are, you can communicate to stakeholders and they'll get just the gist of what you're trying to communicate in terms of health disparities. So next we're going to do bar charts. So again, this is just how I did the horizontal bar chart. Of course, you could flip the axis and do it vertically. Then I showed that one there. I configured my axis info. My y-axis is county, my x is HIV. And I obviously want to sort from highest to lowest because I think the default position is to give alphabetical order, I believe. And then so I always want to sort from highest to lowest. And then I always also include the gradients. I like my colors to map to the count. So the lighter counts tend to have fewer, the darker colors tend to have more. And that's just my own personal preference. But you can play around with it whatever you want. And so we'll run that. It's not defined. Name sorted data.
In the cell before, you called it sorted line data.
So that means we need to change the name. So let's see, we need to change data to sorted data. All right, so we're calling it sorted data here. And doing this with eyes over 50 sorted line without reading glasses on is a challenge.
I think you have 2 underscores in there too.
Do I have to?
In the
Let's see.
sorted underscore data, so it might spit on you again. If you...
Sorted underscore. Write it that way. How to do it? Sorted underscore line underscore data, and then sorted underscore data. Isn't there underscore data?
You have
there's-
sorted underscore underscore.
I think
Oh, there's 2 underscores. See. Will not claim that I can see well without my reading glasses on. Okay. Let's see. Now, this again is probably redundant. I like redundancy. Did I not spell it right? I can't.
No, it's the very first in line 2 where it says sorted and then it says underscore.
You
There's
wanna take one of those out.
Yeah.
Okay.
It's hiding.
Okay, so again, redundancy, that's me, I'm not a software engineer, I'm gonna always wanna, every place I'm doing some data, changing some names, I'm gonna always wanna look at the data. Now, this wasn't a big data set. If it had been a big data set, I would have done just head to see what the first 5 rows looks like, just to be sure. This is just extra stuff that I do because, you know, I come from a science background, I just wanna make sure everything is done the way it should be. Okay, so now we're gonna go to our bar chart and it should work now that we have the right name. And it gave me the inverse, but that's okay. Oh gosh, it did give me the inverse. So again, Travis has the fewest, Harris County has the most. All right, let's go to the next one. Oh gosh, 15 minutes, violin plots. Actually, I'm gonna skip violin plots. You can go through that one on your own. In the interest of time, I'm gonna skip down to our correlation map because I think that one is pretty telling in terms of data. All right. Okay, so here I'm recreating my data set. I actually didn't go from the imported data set. Series of dictionaries with that information. I'm reading in the data frame. I'm calling it DF, changing the name, and then going through and producing my heat map. Now again, this is a correlation. Anytime you're doing social determinants of health, I think this is just a key thing that you always want to do. You want to see how different things are correlated with what you're ultimately looking for. So, in the interest of time, we're going to run through this one, this last one. And we did get our correlation map, thank goodness. Okay, so as I'm pointing out before, the homicide rate, the less suppressed a community is, the higher the homicide rate seems to be. The more wealthy a community is, the more virally suppressed they seem to be. All right, so with that, I'm gonna sum this up because again, we got some time issues here. I wanna make sure I show you what not to do. Now, with that said, are there any questions here? Again, these are just very basic charts that, again, depending on your audience, and I'll talk a little bit about that in a few more minutes of how you adopt your visualizations to the audience that you're speaking to. This is probably highly technical. I wouldn't give this to a stakeholder that had no data background. This is something that maybe between data scientists or data analysts or maybe the project manager would have an understanding about how to read this. But this is a very high technical graph. Yes?
Getting the results in.
Did anyone else get blanks for their?
Strong data.
Yeah, make sure you named the variable that you're pulling from the data. All right, any other questions? In the interest of time, I'm gonna
just one quick thing. It looks like we need a different data set for the violin plot. Can you put that in your GitHub when you
what is violin?
take suppression data or something?
Okay, it's not the same as before. Oh, okay, fake income suppression data. Okay, yeah, I will try to get that to you guys as soon as I can. Okay, so sorry about that. The fake, so when I'm designing my studies, and everybody's different with this, I always create a fake data set just to test what's gonna work, what might not work. A lot of times I don't have access to the data, it often isn't ready, or I need to go to a warehouse and there's a ton of different cleaning that I need to do to it, right? And that's actually usually the case. You're pulling from a data warehouse, you gotta clean it, you gotta format it. But in the absence of, of time, or in the interest of time, I always do a fake data set with variables I think are important, because what that does is gives me insight into what I might need to be looking for. So I do this very regularly from 9 to 5, and it's an extra step, I get it, but to me it's extra practice, which is great. But more than that, it's really, especially if you're dealing with deadlines, right? It's important to kind of know what you're looking for and know how things may plot out. You don't know that until you look at the data, but if the data's really dirty, there's some time you just spend doing that. So I just create, in sample size 500, fake data set. There's a Python package for doing that, I think it's called Faker. And that's what I use here to create what you see here. Now I also will prompt it, so I'll say, okay, please show disparities that I need to see in the data so that it'll be as realistic as possible. But yeah, so I will try to make that data available as soon as I can. All right, so with that, I want to go back to the presentation. Any other questions here? Okay, so again, this is 4 or 5 basic data plots that are very key for communicating with folks from very scientifically oriented to people who are, on the board who have to provide funding for this particular project. Now, what I'm going to discuss next are what you should not do. I think that's probably as important as what you should do. So I'm going to show you some things that I purposely messed up, some that I actually caught after I submitted my dissertation. I had to snatch it back and say, wait a minute, I got to clear this up. Mostly things around making things accessible to other people. I think that's something that we need to think about a little bit more when we're creating our visualizations. Slide, actually. Oops, I'm sorry. Oh, it's okay. So we just scroll down to it, right? So let me actually, let's see. Yeah, there we go. All right, so a review of visuals. The good, the bad, and the ridiculous. Is kind of how it boils down with data sometimes. All right, question, what is wrong with this pie chart? I am showing 10 states by number of HIV diagnoses among Black people for 2022. So this is our updated data set. You raise your hand and you can, what do you think is wrong?
I just their percentage of the total diagnoses in the 10 states.
Mm-hmm. Yes.
Well, it's exactly that. Those are percents of different things. That doesn't add up to 100.
Anybody else?
I think the colors are too close.
Yeah. Anybody else? Yes.
It is a pie chart.
Okay. Okay, so we're gonna have a discussion about that one. Hold that thought. Anybody else?
Text is tiny.
Okay.
Yeah.
Anyone else? This is what not to do. Okay. The first thing that came to my mind, first of all, I like pie charts. The issue is the number of slices. This is way too many slices in the pie, and I like pie. But when it comes to pie charts, the most number of slices I'll put in a pie chart is 5, and I'll always use accessible colors. This is not good. And you guys may have take some issue. Now the text to me, that could be hit or miss. I think the text is okay, but All right, next chart. This is a little better, I think, in terms of color, in terms of slices. Yeah, better representation there. All right, let's go to our next one. What's wrong with this chart?
It's not clear. I mean, the keys in the middle, which is fine, but I don't mind.
That's personal preference. I mean, what's really wrong with this chart? Yes.
Why is it a line graph when it's not portraying something over time?
It doesn't always have to. Line charts don't have to portray things over time. Anybody else? What's wrong? Yes.
I think the fact that the lines are connected is confusing. It makes it sound like it's the same thing, or it's just hard to distinguish between the lines.
Okay. Maybe I shouldn't have did this in my dissertation. I get that. Anybody else? Yes.
I think this is personal preference, but 2 y-axes.
2, you said white or wide?
Y.
Wide.
Okay. Okay. I mean, that could be confusing for some. Yes.
I can't tell which y-axis is correlated to which line, because they're both are percentages.
Mm-hmm.
I don't know which one's which.
Okay.
What does BWLH mean?
Black women living with HIV. So this should have had a label, Black women living with HIV, right? Now, again, This is from my dissertation, so not the wrong one, but okay, so and I'll explain it when I get to it. So the only thing that I think is wrong with this, having used it in my dissertation, is that it's red. The bar charts are red. That's someone, colorblind is not gonna, this isn't gonna go over well. So it's really a basic thing. There should be a label on this other y-axis and then it'd be clear, right? Now, the thing is that I purposely wanted to do I'm trying to show two different things in one chart. That was my whole point. And the point being that limited access to food and food insecurity are all about food. So I wanted to be able to graph those. Again, might be a personal preference thing, right? Nobody on my committee was confused, and it made sense to me, but it could be better, right? I could have added something over here. So let me see, I should look at this. So this is a little better in terms of color, but again, adding an axis would have been great. Somebody said, don't put it in the middle. So it's at the bottom here. Personal preference, but the big thing with this one was that the color is what should have been more clear. And maybe the color between the two lines I did use is a little too close in color, like maybe green and blue is what I typically use, but because the bars are blue, I didn't want to go with blue. Okay, so yeah, that's better, right? Oops. And then of course I did another one. I actually meant to take this one out, but we'll go to this one. What's wrong with this chart? Yes.
It's not clear which. It is. Never mind.
Yes.
Using the log scale, and that took me a minute to pick up on.
Yeah, and we'll talk about why that could really be bad because it happened a lot with COVID. Yeah. That's why I wanted to show this one. Anyone else? Yeah.
It's hard to distinguish the percentages. You get one bar but two percentages. What is that? I'm not sure what that means. You got 23,445 and 16,317, and they're all. Is it the same percentage? I mean, what's the?
Is the percentage referring to the total as the top of
it is.
The experience?
Okay. Per the label there. And then the red bar, they're just HIV cases. Commas in there would have been more clear though. I mean, you can always be more clear. Like there's something wrong with being more clear. Yes.
Why are all the bars the same color?
Personal preference. You're right about the color thing. Red. We're back to red again. Just try not to use red. Now, the reason I use red originally is because red is the color for HIV, which is why I have on red today, right? But when you're speaking to a different kind of audience, you just got to be aware. It's just this isn't good for it's not accessible to everybody, so that's a challenge. Okay, but the log scale is the big thing. So what happened a lot during COVID is when people wanted to just show that they had COVID cases, but they didn't want to show how big the disparities were, they would do stuff like this. So if you look at this, you're thinking, oh, well, HIV in Houston is not that far off from travel. They're not looking at the numbers. And this is a person that's not a data person. They're just looking at the size of the bar. And they're saying, wow, well, Houston doesn't have that much more HIV than Travis. Actually, they've got about 4 times as much HIV as Travis in terms of Black women living with HIV. So this is what's called deceptive graphing, and we saw it a lot with COVID in certain states that did not adopt ACA. Okay, well this and then the log scale is just bad. I mean, because it's like you're being purposely deceitful. You don't want to show that there's a big disparity between Houston and Austin, so we're just going to do a log scale. So it looks like, because again, a person that's not a stakeholder, a person that's a stakeholder but it's not involved with the data, they're just going to look and say, they're not really looking at the numbers. They're just looking at the bar. Well, this is just terrible. So never do this, right? Never do that. Yes.
I just want to throw you a 2-minute warning.
Sure. Oh, thanks.
Yeah.
Yeah, okay. All right, so ethics and effectiveness and visualization. Data integrity, what I just shown was not data integrity. Just make sure your visuals are truthfully representing the data. Don't cherry pick, okay, not good. Got some examples there. Audience awareness, tailor your message to the person you are talking to. A scientific person may be okay with a correlation map. Someone that doesn't have that advanced level may be better with a bar chart. So just tailor your message. Inclusivity, accessibility, I talked about red is just not the color, red or green, try not to do that. Make sure you explain things. Someone asked me about BWLH, any acronyms, MSM, men who have sex with men, not MSM. Everybody doesn't know that that's what that stands for. And then actionability, make sure that your visuals can result in actions and decisions being made. So when I show that first bar chart with not on a log scale, that showed that Houston had a significantly higher amount of Black women living with HIV than Austin, and you got limited funds, you probably want to target it to Houston just based on the numbers. So again, that makes my bar chart actionable. Oh, post Kahoot, we probably don't have time for unless you guys just wanna, yes.
May I add one other thing?
Sure.
This is just a point of curiosity. Even when you have those 5 things in the bar chart, if you're trying to, for someone to differentiate between like 18% and 17% and 15%, might get a horizontal bar chart instead, so that the point that you're trying to get across is the one that's emphasized.
Okay, yeah, it's all personal to your message that you're trying to get across. There's a lot of different ways to do it. That's what I actually love about the work that we do with visualization. There's no one way to do it. Okay, we don't have time for a post Kahoot quiz, unfortunately, because we gotta get you guys to lunch. So, all right, who was in second place for the thing? I'll give them the card. Who got second place for the Kahoot? Does anybody remember? I thought I announced it. Okay, we gotta decide who should get it. All right, I'll tell you what, I'll make it really simple. I will write a number on this paper between 1 and 50. And whoever comes close or guesses the number will get the card. How about we do that in the interest of time? Okay. Anybody want to take a guess at the number for a card? Yes.
43.
No.
43.
25.
What?
25.
No.
45.
Nope. Anybody else? Yes.
37.
35 is close. She gets the card. Let's go ahead and go with that.
There you go.
Okay.
Thank you.
Thank you.
Thanks, everybody.
Thank you so much.
And thank you for your patience for all the technical stuff.